My name's Carrie Lethborg. I'm a cancer social worker. I've worked in this area for a bit over 25 years. And one of the really common things that I see in women who have finished treatment for early stage breast cancer is this anxiety around fear of recurrence, fear of the cancer coming back or this experience happening again. I think fear of recurrence, term often used, or just the anxiety about what happens when treatment finishes, is possibly the most common concern, psychological concern that happens when treatment finishes for really the majority of women who've finished treatment for breast cancer. And I think that that's an understandable, really understandable part of the process. I think sometimes we underestimate that there needs to be a recovery period after you've been through this experience. Fear of recurrence can include being really scared that your cancer's going to come back. It can be fear of having your life disrupted again because you were going along with, planning the way you wanted your life, feeling like you had control over things, and suddenly everything got turned upside down. So I think that fear that that's going to happen again, fear that there's going to be family disruption, fear of having to have treatment again, and just a general fear. Some women can become what we would call very hypervigilant about their body. So every time you get an ache or a headache or a pain or something, you can think, oh my gosh, it's cancer, it's come back. And that can either lead to you going to your GP constantly and wanting to get things checked out, or being so scared you don't get anything checked out and you just get more and more stressed. Fear of recurrence can be particularly high in younger women, and I think one of the reasons for that is that you have a view of where your life's heading, and the last thing you expect is for something to come along and turn it upside down. I mean, I think that happens any age, but I think when you're at a point where your career's starting, or you've just started a family, or about to start a family, or whatever's happening in that period of life, it just doesn't fit the way that you viewed what life was going to be. And so I think particularly in that group, the process of what does it mean now for me to go on with my life afterwards, it just can be more difficult. I firmly believe that cancer happens to a whole family, and I use the term family quite loosely, so I mean anyone who's important to that person. I think cancer comes in to a whole group of people and it affects all their lives. But I think the journey can be a different journey for the patient and the family members. I just think the level of distress that it can cause and disruption is about the same. It's my real belief. One of the things that we have found with partners, or with the main carer of someone, women who have finished treatment for breast cancer in particular, we've done some research into this, is that at the start, that complete disruption and disbelief of diagnosis happens kind of at the same time. But then the journey's quite different. And when treatment finishes, often I think partners are ready to just get back to normal. They've been pacing themselves to that point. Whereas the women have been just focusing on getting through. And so their whole view has been just what's here in front of me. So what can happen, I think, when treatment finishes is that the woman is like, okay, gosh, that happened to me, that was really big, what does this mean for my life? What is that pain in my arm? All those kinds of things are starting to happen. I know some women who haven't cried until that point. And for their partners, that's not always the case, but partners have often kind of gone, yay, this is a relief now, we can get things back to normal. And so I think that can be a really tense time. And we know that, cancer has this ripple effect. And I think this period of finishing treatment and what does this mean for me and then for the family in the future can be a particularly difficult time because it has impacted on everyone in different ways. And the most useful thing is to actually sit down and go, what was it like for you? What was it like for me? Because we all went through it together, but we had to just really survive. I think that period of treatment and the busyness and people coming around and all the phone calls, you don't really have time to really think about it. But the positive side is that it's a time to be able to stop and go, what does this mean for us? What's meaningful for us? How do we look after each other now in this next phase? I guess we think about the people that are really struggling and who, it isn't just an adjustment, an easy adjustment, and they get on and it becomes less and less of a problem. The people that I would be concerned about are the ones that are worrying all the time, are really feeling like this is on their mind all the time. It's preventing them from getting back into their social world. And I think it can feel very isolating. You go from being, having nurses that you're seeing regularly, people ringing to see how you are, and then it feels like everyone else has gotten on with their life, and you should be grateful and you should be getting on with things. If it's disrupting your life, that's probably the key. If it's actually impacting on you being happy, you being able to either get back to work or see friends, or some people I know even feel like they can't go into big crowds of people. All of that is about anxiety, and it would seem to me that that would be the time to actually be able to stop and say, I probably need some help. And it might mean having a couple of sessions with someone where you actually can just stop, review what's happened to you, which is always useful when you've been through a trauma. Actually have a think about, what does this mean for me in the future? And I think the thing about having fears is that you need to check them out. So sometimes those fears are about not having the knowledge, or not being sure why you've got to have a scan every 6 months or 12 months. So not actually really understanding, what am I dealing with now? So sometimes it's just getting some of those answers, and sometimes it's about putting some of those things out of your mind.